Hydro procedures form a routine part of cataract surgery in whatever way they are practiced. The end point is usually rotation of the nucleus, after which phacoemulsification begins. But once the nucleus is removed, most of the cortical material stays behind. Now, a separate step is required to clear the cortex, which is not only time-consuming, but there is always the risk of posterior capsule misadventure. The solution to this recurring issue was suggested 25 years ago by Dr. I. Fine in the form of cortical cleaving hydrodissection. Let me say this in his own words. I have found that a fluid wave can be injected just under the anterior capsule in such a way that it separates the cortex or most of the cortex from the capsule. Because of that, irrigation and aspiration of the cortex as a separate step is not required. Based on these teachings, this is how I perform the procedure of cortical cleaving hydrodissection. A cannula is introduced under the anterior capsule and fluid is gently injected to get a complete hydrodissection wave. A similar procedure is then carried in the other quadrant 90 degrees away, with care be taken to decompress the nucleus after seeing the wave. And again, this procedure is done into the third quadrant. With this, the phacoemulsification procedure is then started and carried out in a routine manner. And once this is finished, it can be seen that there are no cortical remnants now remaining in the bag, and the surgeon can now proceed to the next step of implanting an intraocular lens. In this way, a very efficient and quick surgery can be done. Now let me show this procedure step by step. In step 1, the cannula is introduced under the anterior capsule. In step 2, the cannula is then pushed towards the wall of the capsular bag and it gently touches there. Now in step 3, the cannula is moved towards one side after withdrawing it a little. Now once you withdraw it on the fourth step, tent the anterior capsule and it is now time to inject the fluid under the anterior capsule to see the entire hydrodissection wave going across the capsular bag. In step 5, decompress the lens. In the step 6, choose another quadrant where the similar steps are repeated, but you will not see the wave passing through, but instead the nucleus will rise and then it is the indication of the end point. Once this is done, again decompression is done, and in the step 7 the cannula is introduced into the other quadrant and the similar step is done to achieve a complete hydrodissection. Here I am doing this procedure on a grade 3 nucleus, which is harder than usual. The same procedure of cortical cleaving hydrodissection is done in one quadrant and the lens is decompressed. Now the other two quadrants are also hydrodissected, but the fluid wave cannot be seen in the hydrodissection of the other two quadrants. Then a phacoemulsification procedure is performed, at the end of which a clean bag is appreciated. Of course, this also leads to less complications of the posterior capsule. This is a young person who developed a cataract after a trauma. The Cortical cleaving hydrodissection is performed as we have seen in the previous steps. But after performing phacoemulsification, it can be appreciated that the amount of cortical material remaining behind is more, and hence a separate step of bimanual irrigation aspiration has to be performed. A warning stands to avoid this procedure in posterior polar cataracts. As with any procedure, there are chances of complications like iris prolapse, posterior capsular rupture, and a capsular block. But if performed in the proper manner that I have described, the chances of complications are very rare.